This is a popular meme on the internet showing what happens to the brain when the cranium is impacted and the effects of traumatic brain injury. However, this video violates Desjardins' working laws of health. This is not saying that traumatic brain injury does not occur. It is saying that there are more things involved than what is shown in this video that must be considered. It gives a false impression by exaggerating the movement of the brain. There are structures to protect the brain missing from this video. Unfortunately, these structures are omitted, being considered irrelevant to the brain and neurologic function. Just as the temporomandibular disorders cannot be separated from impaired digestive function, the cerebrospinal fluid, falx cerebri, falx tentorum, dura mater, and cranial bone movement cannot be excluded when considering neurologic function or traumatic brain injury. The brain is a complex organ lying in a protective shell and washed in a protective fluid that has multiple functions. The brain is separated into 4 lobes by the falx meninges. What are Desjardins' working laws of health? Why are they important? Should we even consider them? Let's take a look at them. It is important to understand that the way the body works does not change to suit a treatment philosophy or a current philosophy of diseases, cause, and effect. Neurology, physiology, and anatomy in the human body does not change. They have meaning and cannot be ignored or changed to suit a particular philosophy. By understanding the cause, you will understand the effect. Each rationalizes into a procedure that we hope will eliminate the cause of disease and alters the effect back to normal health. No single part of the body can be understood except in relation to the whole. No part of the body can be isolated from its relationship to other parts of the body. No part of the body can exist only in and of itself. Name one part of the body that can be removed, and the body will still function optimally. Alternative healthcare practitioners get upset when patients undergo surgeries that remove organs that possibly could have been rehabilitated to normal function. You may remember the mnemonic of female, fat, and 40. Instead of looking for insulin resistance or bacterial overgrowth, the traditional medical healthcare model is surgery. The uterus is often removed along with the gallbladder. While the argument can be made that they can get along without some of these organs, let's look at it through the prism of philosophy-based anatomy, physiology, and neurology. Where parts of the body can be omitted, excluded, or ignored, even if the parts surround, support, or are adjacent to the philosophy-based body part. If that part does not support the philosophy-based analysis and treatment. These graphics demonstrate chiropractic philosophy-based anatomy, physiology, and neurology. You can see the vertebra and skeletal framework, the mandible for temporomandibular dysfunction, and the brain and spinal cord, all considered the principal body parts according to the philosophy. However, there are some very essential body parts missing. The cerebrospinal fluid, falx meninges, dura mater are all missing. Their omission gives the misrepresentation that they offer little to no influence on the body. During early surgical operations of the brain, it was noticed that the dura had a reciprocal movement that coincided with the ebb and flow of cerebral spinal fluid. This brought about the concept of the primary respiratory mechanism, that cerebral spinal fluid is pumped rhythmically. The primary respiratory mechanism begins with the development of the neural tube before the formation of the heart. There are several critical functions that the cerebral spinal fluid provides for the body.
The CSF ensures the protection of the central nervous system against mechanical shocks and vibrations. It plays an important role in the regulation of intracranial pressure. It participates in the cerebral metabolic processes by regulating the exchange of substances and provides many other functions as well.
Studies have shown the cerebral spinal fluid courses along the spinal nerve roots, bathing the nerves, and thus providing the nerves with necessary glucose and other metabolites. The diffusion of these nutrients from the cerebral spinal fluid in the nerve roots is of greater importance than the nutrition from the blood vessels along the nerve roots. Up to a certain stage, the development of the cranium corresponds with that of the vertebral column, but it is modified later in association with the expansion of the brain vesicles, the formations of the organs of sight, smell, and hearing, and the development of the mouth and pharynx. The cranium develops from the mesenchyme around the developing brain. Basically, the cranium consists of two parts: the neurocranium, which is a protective case for the brain, and the visceral cranium, which is the skeleton of the face. The neurocranium covers the parts of the brain as well as the ears and nose. It is divided into two portions: the membranous neurocranium and the cartilaginous chondrocranium. The membranous neurocranium, as the name implies, is formed by intramembranous ossification. These bones are flexible and remain so throughout life. The flat bones of the skull, like the frontals, parietal, the squamous part of the temporal, the occiput, and the nasal and lacrimal bones are all membranous. The chondrocranium is formed by a combination of mesodermal sclerotome and neurocrest cells. These are the same mesodermal somites contributing to the development of the vertebra. Thus, the 5 pairs of somites making up the chondrocranium are embryologic vertebra, and just as spinal vertebra develop nerve roots exiting between them, so do the embryologic chondrocranium somites. We know these as cranial nerves. And just as vertebral malposition or degenerative processes can affect spinal nerve root function, the same factors can be applied to the chondrocranium bones and the impairment of cranial nerve function. Bones of cartilaginous derivation provide a solid base for the foundation of the skull, thereby providing protection for the passage of arteries and veins supporting the brain, and the cranial nerves exiting the cranium, as well as an anvil for the mastication of food. Alterations in the cranial vault may have a profound but unrecognized effect on cranial nerves, dura, and blood supply in the cranium as well as the rest of the body. The alterations occurring through the torquing of the reciprocal tension membranes as a result of a loss of normal cranial bone motion. The pathophysiology of the cranium is essentially no different from the rest of the body. Structural alterations have an effect on function. It is important to determine the anatomic movements of the cranial bones to better understand their function. When viewing the cranium from this perspective, it sheds an entirely new light on the mechanics of the cranium. Cranial nerve entrapment caused by cranial bones is a distinct possibility. Facial palsy, tic douloureux, hearing and eyesight, etc. may all be affected by cranial bone fixations and misalignments. Headaches, hydrocephalus, and many others also have their roots as a result of alterations within the cranium.